I'm Dr. Cody Gordon. I'm a NUCCA chiropractor at Vibe Health and Spine here in the city of Calgary, Alberta. I've been practicing for over 20 years, and Calgary is a wonderful place. We have the Calgary Stampede every summer, we have the Rocky Mountains just to the west of us, and we have more sunshine and sunny days than just about any city in North America. Another phenomenon we have here in Calgary is the Chinook winds. They're beautiful warm winds that come off of the mountains and give us warm weather in the winter, but they wreak havoc on migraine sufferers. And for the last 20 years, I've been treating a lot of migraine sufferers. Migraine is a difficult phenomenon, mostly because it's a bit of a medical mystery. We still don't know exactly what causes migraines to happen, but we do know some things. We know that there's a vascular component, that the vessels that drain the cranial vault get irritated and contribute to the migraine phenomenon. We know there's a nerve irritation phenomenon as well. The nervous system gets triggered and is a source of a lot of the pain that the migraine sufferer feels. Thirdly, is we know there's an inflammatory component, but it's not any inflammatory component. It's inflammation of the soft tissues that cover the brain. The tissue called the dura gets irritated, inflamed, and he is a big contributor to the pain that the migraine sufferer feels. So why do so many migraine sufferers seem to do well with NUCCA-specific chiropractic care? Let's look at each one of those components individually. If you have a misalignment of the upper neck, it's going to put pressure on the vessels that drain the cranial vault. The first vertebra in your spine can misalign and actually put pressure on the lumen of the jugular vein, the largest vein that drains the cranial vault, and create a bit of a backup in venous blood flow. Second is the neurological component. Every nerve in the human body has to travel through the conduit that is the upper cervical spine to reach the brain. Misalignments of this area can put stress on that neurology and contribute to the migraine phenomenon. Lastly is that dura membrane, those soft tissues that cover the brain. We have specialized muscles at the top of the neck called suboccipital muscles. They coordinate the balance of the head on top of the neck, and they help to coordinate your posture for you as well. When those muscles are stressed because the head doesn't properly sit on the neck in the way that it should, they work really hard all of the time, and they're always pulling and trying to recorrect. These muscles have fibers that reach right through the spine and attach directly to that dura tissue. And if they're pulling and tugging and yanking all the time, they're going to create an inflammatory environment that could be that inflammation that bothers the migraine sufferer so much. NUCCA chiropractic care seeks to address and correct all three of these components. Correcting the misalignment to take pressure off of the vasculature, allow nerves to flow and transmit back and forth to the brain and the body, and to take pressure off of those muscles that attach to the dura membrane so that they're not always pulling and yanking. Look, I hope that this has been helpful, that it's given you a little bit of information. If you are a migraine sufferer or have a loved one who is a migraine sufferer, I hope that you will tell them about NUCCA. Let them watch this little video and do a little bit of their own research. They may really thank you for it. It's probably going to be a game changer for them or for yourself. Again, my name is Dr. Cody Gordon at Vibe Health and Spine. I hope this has been useful for you, and I'll see you again.